Now, pick up your scorecard and let's begin our assessment of the current situation by first looking at the physical facility as an example of what we have learned in the previous videos. Since we have formed the health assessment team, we will now assess the current situation of the healthcare services, do a gap analysis, form an action plan, and present it to management. The 4 steps to be implemented in each video include: 1. Assess the current situation of the healthcare services. 2. Do a gap analysis. 3. Form an action plan. 4. Present your plan to management with recommendations. Assess the current situation of the healthcare services, physical facilities. When we talk about medicines, we are talking about making sure health products are made available to workers, such as non-prescription pain relievers. In our case, they are non-prescription pain relievers, so this is not red, but I cannot find many replacements and some are almost finished, so I can't put it green. When we talk about cleanliness, we are talking about the fact that the health facility is kept clean. An example of that would be that soap and running water or hand sanitizers are available for hand washing at the health facility. Although there was running water, there was no soap. In order to improve this yellow marked indicator, soap should be replenished periodically. In terms of client-provider safety, we are looking at whether the facility does not expose clients and providers to health hazards. In our case, we see that there is a dedicated disposal hazardous material separate from general waste. However, I noticed that although both receptacles are present, the hazardous material was not disposed of properly. So I'll score this indicator as yellow. Let's look at privacy and confidentiality. Privacy and confidentiality explores whether the facility ensures client privacy and protects confidential information. The waiting area is separate from the examination or intake area. In our case, the examination room is completely separate from the waiting room and can be scored as green. However, I don't see a private space separate from client intake provided for client exam, counseling, and other communication. So I cannot score this indicator as green and would rather score it yellow because there is at least a curtain. Lastly, under furniture, which assesses whether there is adequate client furniture available, I see there is a bed available for rest and care. So I'll score this as green. Now take the printed scorecard, take the colored pens, walk around the clinic and check each indicator and give a color to each depending on what you find. Identify areas of improvement. Where do you start? With the limited resources available, how do you prioritize? 2.2.1 Non-prescription pain reliever is available. 1.3.1 Space is provided where provider and client can speak privately and not be overheard. 1.3.5 A private space separate from client intake is provided for client exams, counseling, and other communications. 1.3.2 Waiting area is separate from examination or intake area. Designing an action plan. Although there is a dedicated area to store drugs and there are non-prescription medicines available, I've noticed there are a few remaining. This requires for the team to communicate to management so that pain relievers are bought periodically. Although there is a private space separate from client intake, should a patient need to rest on the bed, a separate resting area is required at a distance from the doctor-patient counseling or examination area. Although there is running water, there was no soap. In order to improve this yellow marked indicator, soap should be replenished periodically. Although there is a separate receptacle for hazardous material and needles, we noticed that it was not used properly. To improve this yellow identified indicator, anyone who uses hazardous material should be reminded to use this dedicated receptacle. So we've identified the areas of improvement. Now, what is the cost associated with each of these improvements? A line budget should be added for this under the health services. After you've identified the improvements and the cost associated to make it happen, consider whether it would be a short-term or a long-term objective. Short-term should be considered as something that can be accomplished within 6 months, while long-term is anything which goes beyond 6 months. Action Plan Template. You have so far identified the gaps, improvements, costs, and time it would take to improve the situation. Now pick 4 of your short-term objectives and 2 of your long-term objectives and integrate them into the action plan template.